doctor panel this morning includes ophthalmologist Dr. Colby Stewart, ear, nose, and throat and allergy specialist Dr. Raza Pasha, interventional cardiologist and endovascular specialist Dr. Raymond Little, and neurosurgeon Dr. Remy Nader. Good morning. This could explain a lot of things. If they say fried food could be more fattening depending on your genes, whatever those genes are, I know that I have them. Okay? Yeah, it's just saying that it could lead to more individualized prescriptions for weight control. But let's back up first and say, talk about the fact that could someone's genes impact how they end up handling food?
Well, certainly there's emerging research, Deborah, looking at the association between genetic profiles and body mass index, because that's the real driver for, what we recognize as folks being unhealthy. So.
Yeah. And plus, the other things that we also know is that how quickly people burn calories. That's not the same for everybody.
Yeah, and as far as like action items are concerned, I mean the genetic disposition, I mean that's more on the doctor side and the pharmaceutical side and how to address it per patient. But as far as patients are concerned, we all know that you shouldn't be eating fat. We all know that, despite what your genetic dispositions are. So we should be eating healthy. We should be exercising. We should be doing all these generic.
Have you ever known anyone, if they were eating healthy and exercising, who didn't have a problem with weight?
Well, yes, certainly.
I mean, there are some people who just have a problem with weight, no matter, even if they're doing everything right.
Yeah, certainly. I mean, there's people that may have more than just a genetic disposition. They may have a thyroid disorder. And there's other more medically necessary that you require more intervention rather than someone who is just has just a predisposition per se.
The majority of us, I think, we're looking for the excuse. We really are. We are.
Well, I think one of the other issues is when we say healthy food versus non-healthy food. I mean, really, calorie in, calorie out is still a main thing. I mean, if you can count the calories, whether it's unhealthy food or good food, and then how many calories you're expending, I mean, that's what's going to help you lose weight, knowing those numbers.
Yeah.
Well, we see a big future in this data helping us customize treatments. One of the things that we focus on is personalized health coaching. And your point is well taken. Even if you have a genetic predisposition, which everybody says they have.
Even if you have a genetic, it's my genes.
Yes, it's my genes. It's really our habits and the awareness of factors in our lives. I say life gets in the way, and that's the #1 thing that causes us to be unhealthy. Certainly, if there's some genetic connection or a medical reason, then that sort of boosts your likelihood to be unhealthy. But the real thing that you have control of is your habits, and we focus on that in health coaching.
All right. One of those things in medicine that we are so looking for the cure for, desperately looking for the cure for, hadn't come yet, is when we deal with migraines. There is a new migraine headband that could help offer some relief. The FDA just approved it's a nerve-stimulating headband. First of all, explain what migraines are compared to just a regular headache, and then how this headband could help.
So migraines are vascular headaches, meaning that they occur because there's some kind of dilation in the blood vessels in your brain that will send more blood to your brain and make some nerves get stimulated that usually aren't stimulated, and it will cause you to have these headaches. So
that's why it's not as easy just to pop a couple of aspirin and then it goes away.
That's correct. Yes. So there's some traditional treatments for migraines. Have been some medications that can modulate this vascular phenomenon and help, but obviously now we have some new technologies that are available as well.
And it's interesting because we've seen kind of the same technology to deal with back relief and things like that as well.
Sometimes, especially with migraines, we may not be able to address the migraines directly, but we can address the triggers.
Right.
And if you can find out what those triggers are, then you can address it indirectly. And in our example, we'll talk a little bit about that later on, is that some people may have what's called a headache that's induced by having their nose congested or allergies. So if you address that, then you might not necessarily cure the migraine, but at least you address the
It goes back to what basic medicine should be. Let's find the cause first, and if you can remove the cause, then you can remove the problem. All right, a new discovery solves the problem of anti-inflammatory substance. It blocks the enzyme LTA4 hydrolase. We're hearing much more about things that cause inflammation in the body. Why is inflammation in the body the problem?
Well,
is that what causes
yeah,
disease?
well,
Is that what makes the body weaker?
Yeah, I mean, as far as this idea of hypersensitivity, a hyperinflammatory state, has been connected with so many disease processes. Everything from eczema, asthma, to skin disorders, to even heart disorders, and problems with metabolism. So there's a whole science that's how do we take down this hypersensitivity, this sensitivity that
Could it
causes...
suggest that your body's in crisis in some way?
Exactly.
Okay.
So there's all these medications that are out that are trying to be more specific to whatever that causes. The best example is ibuprofen. I mean, we take ibuprofen, we have muscle disorders, and steroids is like the drug of choice for almost everything.
Yeah.
Especially when you talk about the eye, the inflammation is a reaction to something. Maybe it could be an infection, a bacteria, a virus. So inflammatory process is not necessarily bad, but sometimes the inflammation itself can cause more damage than the actual
Yeah, so it's kind of like
bacteria.
waving the red flag that something's wrong here. So is just blocking that enzyme doing any good, or is it about finding what's causing the inflammation to begin with?
Well, that's an interesting point. So there's a concept called sort of response to injury. And when biological tissues are injured in some way, and there's actually even some emerging evidence that says that some of these inflammatory factors are in adipose tissue. So, our fat may be even more dangerous than we think in some scenarios, but it triggers this pathway that stimulates a reaction and then calls some other people to the party. And it's that continuous, interaction with all these layer and layer of substances that creates disease.
Okay. Audience members, how many of you know someone who might snore? You know them. How many of you are the snorer? Yeah, most of the time. We have a few people who are honest going, I'm the one who snores. Okay, so you're used to that thing in the middle of the night of, hey, and then somebody nudging you. Okay, well, now there's a snore-triggered nudging pillow for your snoring partner. This be you street snoring, Dr. Pasha. So have you seen this pillow?
Yeah.
Hey.
There's a lot of devices that will electrocute your bed partner if they make sound. A cattle prod does the same thing.
This one has a microphone that picks up sonic vibrations of snoring, and then when it detects snoring, and the airbag inflates about 3 inches and nudges the snorer into changing positions. Because sometimes the snoring can be impacted, the intensity of it, by how high you might be laying or whatever. Okay, so this snoring partner has that pillow available to them. Now, your point then, we're going to go back to, again, why is that person snoring?
That's right. I wouldn't be an advocate for such a device, only because it's interrupting your sleep. And if you have a problem of a partner who's snoring, you need to address why they're snoring. Is it serious? Do they have sleep apnea? But whenever you interrupt somebody's sleep, they pull out from a deep sleep to a light sleep, and then what happens is they may not snore, and it'd be good for the bed partner, but you're interrupting their sleep, they wake up, they're tired, they become inefficient, and then that leads to a whole cascade.
Yeah, there's a vicious cycle.
A lot of people that snore do have some degree of sleep apnea, right? I mean, that's what, and they're already waking up many times throughout the night, and waking them up some more times. Probably not going to be.
Okay, make an appointment, or I have a feeling a lot of these pillows might be so. Wait, you went now?
There may be some benefits to the pillow. I mean, just changing certain positions when you sleep, not only can help, increase the amount of oxygen you get in and so forth. However, we have to take it with a grain of salt, obviously, like Dr. Pasha was saying.
Yeah, because it's a snore-triggered nudging pillow, not a miracle nudging pillow.
Right.
All right. Well, gentlemen, thank you very much. Hey, today on Facebook, we discussed earlier in Hot Topics how there's that new headband for headaches, there's that snore pillow. So we want to know, what's the next big invention you would like to see medical science come up with to help with common ailments? How about a new Band-Aid that heals small wounds right away? Or a special handheld device that wipes wrinkles off your skin in an instant? I want that one. Log on and let us know what you think. We'll share some of your comments later in the show. Well, her vision started declining 6 years ago. Eventually, she became legally blind.
I would like to start reading again. I've kind of stopped because of the eyes. I'm looking forward to just being able to see without blurs.
So how did she get 20/20 vision in less than 24 hours? Her story is next.